Good morning. I'm Hernando County Sheriff Al Nienhuis. We're here live at the Emergency Operations Center behind us in Hernando County. I'm joined here with Chairman of the Board of County Commissioners, John Mitten, and County Administrator Jeff Rogers. We're going to give it about another minute or so before we get started. Obviously, if you have a question that you'd like to ask the panel here, if it's a general question, you can just post it in the comments. If you have a particular individual that you want the question addressed by, whether it's a sheriff or the commissioner or the county administrator, just go ahead and put who it's to, and we're going to do our best to answer those questions. Again, if we don't get to your question today, we'll probably put up some links on contact information where you can get a hold of the sheriff's office and send an email to the sheriff, or send an email to the county administration and try to get your question answered if we can't answer it today. A couple ground rules: we'd really appreciate if you could keep your questions focused on the pandemic and Hernando County specifically. It's going to be impossible for us to address issues that are on a national level, or even most of the questions that regard the state level. So just please keep that in mind as you ask your questions. So again, we'll give it another minute or so. We want to start right at 9:30. Again, Chairman Mitten, do you have anything you'd like to say to greet our public?
Just welcome, and I'm glad to be able to have this opportunity to talk through some of the questions that are out there. Throw anything at us, we'll try and field it, and regarding this pandemic and COVID, especially as it relates to Hernando County.
Okay, and County Administrator, would you like to say?
Yeah, well, good morning. Happy Friday. Rainy today a little bit, but we're looking for a great Friday here. I will tell you that, again, as we look forward to any questions and answering any concerns, anything that hasn't been addressed through all the communication we've given out. Lastly, before we get started today, I'd like to thank everyone. I think our community, again, is thank you for first tuning in today and taking concern of the community and helping us. If you can share this to your friends and post, that's a great idea to help us get more people involved. And then thank you for the social distancing and the patience that our community has had in the last month now that we've been in this engaged. We appreciate it, buddy. And what we need to do is to continue these new practices and new ways of life that we have today. We need to continue that as we move forward. And if you don't mind, I can see a couple questions coming shortly. We were going to talk a little bit about where we're heading with this, Sheriff, but let's answer some questions. That's all right.
Sure.
Right ahead. Quickly, I can see that a couple questions come through about the dog park, and we're going to kind of go where we're heading with the reopening and everything about the county. I can tell you where we're heading with the county parks, and the dog park in particular is a question that what we're doing is I've made a recommendation. Obviously, at the beginning of April, we shut down the county parks, the majority of them, because of the peak, and tried to minimize the amount of people in the community that got infected. And so, as you knew, that we kind of passed the peak in Hernando County, and we reduced our infection rate. I've made a recommendation yesterday to the executive policy group, some of the leaders in this room here, and their discussion points. And on Tuesday, your Board of County Commissioners will review my recommendation to reopen the county parks with some new way of life, new social distancing that is kind of going to be the new norm. So we're going to, as we start to reopen anything in Hernando County, we're going to have new ways that we all have to behave, and we all have to do our personal policies on social distancing. So we're going to recommend on Wednesday that the county parks start to reopen. That includes the dog park, and then we include a lot of the other parks in the county. We're going to have some restrictions on those parks, but to answer that question is Wednesday will be the dog park hopefully reopening.
Yeah, and I see that somebody put on here about the Suncoast Trail and riding bicycles. I think the president, the governor, and of course your local leaders encourage you to get outside and get some physical activity, whether it's walking, riding bicycles, or other things. And as the parks open, we'll be able to open it. Just make sure that you do a couple things to be safe on the Suncoast Parkway. Particularly children need to wear helmets. I've seen some children out there riding their bicycles without helmets. And then try to keep your social distancing. Try to stay with your close family. Have them stay with you. I would not ride in large groups. Not so much because you're going to be dangerous while you're riding, but while you're getting ready to ride and when you're done riding, standing around close to each other, you might have an issue. But just riding your bicycle on the Suncoast Parkway, it's going to be very, very unlikely that you're going to be able to be exposed to the virus. So hopefully that answers the question there. Talking a little bit about bars and restaurant openings, we are waiting on direction from obviously President Trump, and more importantly in this particular issue, Governor DeSantis, to give us some direction on when we can open those bars and restaurants. My guess is that we're going to have some changes here coming in the next several days, if not weeks, and hopefully we'll get some direction on that. When the bars and restaurants do open, however, both those owners of those businesses as well as the customers need to keep in mind that just because you're able to do something doesn't mean that it's always a good idea. And when you do it, please don't push the envelope when it comes to social distancing. We still need to maintain our distance. Cover your cough definitely when you cough. Maybe even wear, if you feel like you have a little bit of a cough or a little bit of a cold, for the benefit of those around you, wear some face covering. Sanitize your hands often if you can't wash them, and if you can wash them, spend at least 20 minutes or 20 seconds rather washing your hands. And for those owners particularly, keep in mind the last thing you want to do is have an infection be able to be traced back to your business. So even if you're allowed to open, you really need to pay attention to those recommendations by the CDC and the health department as far as keeping everybody safe, especially as we move forward.
Sheriff, I think you're spot on there. I think what we're waiting on is this process at the state level with the governor and with his task force. He has a task force that's meeting, an executive task force, and they're going through what does a Florida that's now reopened look like and how do we get there. Underneath that executive task force, they have industry-specific, almost committee-like task forces that are meeting earlier in the day. They're hashing through a lot of details. They're giving that to the executive committee in the afternoon. The executive committee is then working and meeting, and then they are going to make a recommendation, I believe, this afternoon to the governor.
Right.
And we should hear from the governor more about what the future looks and how fast we're going to get there. But I will tell you, because none of us want to get back to where we are right here. We don't want to be shut in. We're going to have to go slowly, methodically, and with good prudence and measured reason as we open Florida back up. We're going to need restaurants. We're going to need bars. We're going to need, any time we have people that could be close together, they're going to have some standards there that just make good sense. Until we get a vaccine where we know the other person and we're not going to affect each other, until we get that vaccine, we're going to have to be careful, because if the numbers spike back up, that's a real bad thing. We don't want that.
Exactly.
So the governor's going to give local government some instructions and some guidance, and I really believe our governor's done a fantastic job at allowing local governors or local government to govern. And so the county commission, administrator, sheriff, all of us are looking at, okay, how do we take Hernando County based on the guidance from the governor? How do we move Hernando County forward? I will tell you, this commissioner, and I think the spirit within which our county exists, it's a great county to live in, let me tell you. I think we want to get out of the way and let people get back to work and let people be able to go out and do the things they do, but do it with caution.
Absolutely. And one of the issues that I've been questioned on several times, and I see somebody asked it here, is about churches. I think churches are very similar to our restaurants as far as a practical response to that. We have to move slowly. Of course, I don't think there is any church family that wants to be associated with an outbreak of the coronavirus. I know the governor has given a lot of latitude to our religious organizations. They are considered an essential activity, so that does give them some latitude. Of course, it's difficult making those laws and making them black and white. So if a congregation decides that they want to move forward, they need to do so prudently, not just because what the law says or what the governor says, but because the last thing in the world I think any church family wants is to have 20 or 30 or 50 or more of their congregation come down with coronavirus as a result of moving too quickly. to bring people back together. And I know it's a struggle for everybody, but and it's not even, in my opinion, from what I've read, it's not even so much the actual church service, particularly if you have social distancing. It's going to be more before the service starts, and of course after the service lets out. It's going to be very difficult to keep those people away from each other. They're going to want to naturally group together, and we certainly don't want that. So churches, church families, church leaders, pastors, and rabbis and the like just need to take those things into consideration, not just what the governor allows, but what's prudent in your particular situation. And I can assure you that from the sheriff's office standpoint, if you are making a diligent, good faith effort to keep your congregation safe, the most we're probably going to do is do some education if we find that there's some things that we're concerned about. So that's going to be moving forward. Hopefully we'll get even more direction on that in the next, as he said, maybe the governor can give us some more direction here in the next several days or weeks. But that's specifically regarding churches. One poster asked about, I see people grouping together. What should I do? Should I mind my own business or should I call? I don't think it's ever a bad thing to call. We'll go and we'll take a look at it. If it's a close family that live together anyway, and they're interacting and they just happen to be outside interacting, obviously that's not near as serious as 20 or 30 strangers gathering together at a park, at a pavilion or something like that. So each situation is going to be different. We're going to handle it. The governor's order that's in place at the moment is pretty clear that you really don't want to congregate with strangers, whether it's in a park, in your front yard, in a boat, or anything. You want to just stay with people that you live with to prevent the spread. We have pretty good reason that's probably going to open up a little bit. To what degree, we don't know yet, and we certainly don't want to anticipate what the governor's going to do and be incorrect in that. So, you have anything else, Mr. Rogers?
Well, I can see there's a lot of questions that have been asked, and I think that we've addressed. I think real quickly talking about these businesses, and there's lots of different types of businesses being listed here. Everything from restaurants to bars to nail salons, funeral parlors, and even gyms, right? So those are all coming out with the governor's guidance, right? And so those are all going to be some kind of risk level that's going to come out, and there's going to be some guidance to which you can operate within. And when you're allowed is going to be, obviously we have to wait for that guidance from the governor, when you can reopen, when you're not, when the stay-at-home order is lifted, and then when you can reopen. But at the same time is these business owners and restaurants and churches, and everybody has to take their own self and do their own work in their business and determine how you can have a safe environment within your area of practice. And so how you can have a safe environment for your employees and also for the public coming into it. And if it's not a safe environment, the people are not going to be going there. And Hernando County, again, we've proven that by the way in which our case level has stayed relatively low. And so I've seen a question that talked about that. What are the numbers? Well, they are 83 currently positive cases in our community. We are in day 7 right now without a positive case. Day 8 on decreasing numbers of positive cases within our county. So again, thank you very much for the social distancing that we've done. And now going forward, I've seen some comments about people that should be opening these. Well, if you are more highly susceptible to this, or you have a concern for someone you are, then by all means, please don't go to these facilities. Right?
Exactly.
So take that personal decision and don't go with these areas where there are people. If the parks are going to be a concern for you, please don't go to the parks.
Absolutely.
And so, but if you see something like that, as the sheriff said, please call and we'll address it. We're going to have a lot of signage. And if I can answer a couple other quick questions here. When somebody asks Pine Island, a goal on Pine Island is also to reopen Pine Island. And next week also at a lower capacity than full capacity. We're going to slowly walk forward. We slowed this thing down. We walked away from this when it became. We're going to slowly walk to allow Pine Island to be used again. So there will be a reduced capacity at Pine Island recommended by me next week to the Board of County Commissioners. So we're hoping to look for that next week. And then back to you if you have any others.
I think one thing we really want to emphasize here, and I want to make sure we talk about this and stress it. Mr. Rogers hit on a very good point. It's been since Saturday since we've had a positive case. And I was talking to the person in charge of the Department of Health here in Hernando County, and she verified what I thought kind of already knew, is that that's positive case that was almost a week ago. That person actually probably contracted the virus at least a week prior to that. And most of the individuals that we're seeing positive cases are from households. I think I want to say it was maybe half or more of those positive cases caught it from somebody that was very closely related to them. The point there is that what we've been doing has been working. Now we're not seeing that, we haven't seen the fruits of it till last Saturday, but because it does take time. These tests do not get done immediately. Hopefully that's in the future. We'll be able to do instantaneous tests, but right now they can take anywhere from a day or two up to a week or more, depending on how overloaded the labs are. And of course, if you do catch the virus, it often takes, generally every study I've seen is about 5 to 14 days to show symptoms. So when we get a positive test, you got to backtrack that probably at least a week from where that person caught it. So the 0 tests on Saturday means we probably haven't had anybody catch the virus and be tested positive for at least a week prior to that. So what we've been doing over the last month has really made a huge difference. And we can continue to do that. I think the governor shut down, of course I haven't spoken with him directly about this, but I think he had to look at the worst areas in the state and make his decisions based on those. And fortunately or unfortunately in Hernando County, maybe we didn't need restrictions quite that tight to prevent those here. But the good news is it's better to be safe than sorry. And because of the restrictions that we were doing prior to the stay-at-home order and since the stay-at-home order have definitely been working, or we'd see a lot more positive cases here. So that's good news. So thank you for those of you who are doing those smart things. Continue to keep doing those regardless of what happens with the restrictions, because it will keep you and our community safe. And kind of along those lines, somebody asked about wearing masks. Masks are voluntary. Masks generally, unless you're dealing with somebody you know is sick, close, like you're taking care of a relative or something who is definitely has the virus. If you're just out in public, the main reason for the masks is to keep you from coughing or sneezing or breathing on somebody and possibly giving them the virus if you don't know you have it. Again, if you're not coughing or sneezing or getting in real close contact with people, a mask is kind of optional, but it never hurts to wear it. If you feel more comfortable wearing it when you go out, then by all means wear it. And really, any type of face covering is going to help keep those droplets from leaving your immediate area and getting on somebody else and infecting them. I did see somebody ask quickly about the dental offices. You'd have to talk with your dentist about that if you have a specific issue that you need addressed that's an emergency or a quasi-emergency. I'm sure your dentist has things in place where they can assist you. If it's just a routine cleaning that can wait a little bit, you may want to consider waiting, because obviously the more traffic they have in their offices, the more likely they are to have a contamination. So
I think a lot of the questions that we're seeing regarding specific industries are going to be answered in some degree when we get to that task force recommendations by the governor. For instance, I think hopefully you're going to see some generalized standards across the board. And I think especially when you're going into a restaurant or a bar or even a barber, or maybe it's a retail shop or whatever, you're going to have certain things that those companies are probably going to desire and want to do. Social distancing and helping the customers be able to do that in a format, whether it's quarter capacity, half capacity, or more, having spacing within the actual store. Also, you're going to have some health screening for employees that are probably going to be a recommendation. Maybe there will be some form of PPE as a mask or a face shield, depending upon how close that customer is, etc. And then for the guests themselves, the fact of the matter is Hernando County and Florida has done really well because people have held to the social distance requirements and the staying at home requirements. We did not have an issue in Hernando County, thank you, because of people out and about doing crazy things. Our numbers reflect that. And I think if we, as Floridians, as people who live in Hernando, if we can continue to just live as good human beings, loving each other by staying apart, then I think we'll be able to go and get open faster as we go forward.
And I want to talk, I see several people are talking about testing, and we could probably spend an hour alone talking about testing, but briefly, testing right now is limited and it takes time. And so those tests have got to be sparingly used. And what they did at the very beginning of this pandemic here in Hernando County and elsewhere is look at how many tests they could do a day, because the labs only have so much capacity. And they narrowed those tests down to a few people. And they wanted to get information from those tests, not just to satisfy somebody's curiosity. So they would oftentimes just test those people that traveled to like Italy or New York, the other areas, or China. Those people who showed all the symptoms of coronavirus, namely cough, difficulty breathing, fever, and those types of things. The reason they did that is they wanted to see how much community spread there was. Now, if somebody was in the hospital and had life-threatening symptoms, they were also tested. But keep in mind, regardless of the number of tests we've done, I think we've done about 1,200 tests in Hernando County, give or take, and we've had about 83 people positive. Regarding the numbers going down on that, we did have 85 and it's gone down to 83. The reason that happens is they test somebody, they're positive. When their investigators go out and talk to them, they find out they actually live. They were tested here in the hospital. They actually live in Pasco or Sumter or something. So those numbers get moved to those particular counties. So that's why the numbers actually went down. But if you have to test, you have to use those resources very wisely to figure out where you're going to need ventilators and those types of things. So they were only testing those people they were relatively sure had the virus. Now the really good news is that about 94% of the people that were tested came back negative. Now, of course, we could talk about false positives and false negatives, but when you test 1,200 people and 84 people come back positive, that means that the likelihood of the rest of the population, most people are going to come back negative if they're showing similar symptoms. They may have the flu or whatever. So as testing becomes more available, I'm sure there is nobody who wants to stand in the way of testing. There is no government leader that is saying we're not trying to test, and it's certainly not trying to hide anything. It's just you have very limited resources, and you need to test those people that are going to give you the best data going forward of where to put resources. Or if you're a doctor and you want to treat somebody and they're on a ventilator and they're very, very sick, obviously those people get tested. I was talking to about a week or two after this really got going hot and heavy, the pandemic. I was talking to a administrator in a hospital, and he was saying he was waiting 10 to 14 days to get tests back from a private lab. That's unacceptable, and the reason it was taking so long is probably we were doing too many tests based on that capacity, because getting your results back in 2 weeks doesn't even do you any good, because by the time you get your test back, you could have caught the virus. So please be patient with leaders when it comes to testing. They're going to get those tests out as quickly as they possibly can. I think I've answered about the moving down.
Yep.
And when you get tested, talk to your doctor. If you have a fever, if you have a cough, especially if you're seriously ill, contact your doctor. They'll work with you to get tested. There may be a private lab if the health department can't do it. Again, I don't know what kind of cost to be involved, but there may be some avenues available for you. But just keep in mind that most people that were tested, about 93% in Hernando County, came back negative. So don't automatically assume just because you have a cough and a fever that you definitely have the virus.
And I think if you're showing symptoms,
Right.
then you can get a test done. You
Yeah.
can go to your primary care
Right.
physician, you can go to the health department and go to the hospital, and through those avenues you will be able to get the test. But it's been mentioned since this began how limited some of the testing is, and because Hernando is not a hot spot, a lot of these resources, whether it be PPE or test or what are they called, the inhalers, the
Intubators.
the breathing
ventilators.
machines,
Ventilators, yes.
those are going to counties and areas of the country that need it the most. And so we haven't had a case it's been 7 days, 8 days of declining cases. This is a good thing. 93% are not getting this. So the testing is being frankly routed elsewhere. When we have an abundance of tests, perhaps later this year, I think you're going to see a whole lot more testing potentially as people are able to do these tests in more abundance. I want to take a moment, because I know we all feel this, and just say how sorrowful we are to those that have been affected by this COVID-19 illness. And some people have had significant sicknesses and significant horrific struggles getting through it. But then others have actually lost family members in Hernando County and obviously around the state. And so our hearts go out and our prayers go out to those family members. This is a very scary virus. It's a very real virus. It's been asked about opening up and how quickly. I think we want to make sure we walk slowly because you can't go backwards on this.
Right.
Once we take that step, we're going to continue to move forward. It was asked, who determines how fast Hernando opens after the governor gives its recommendations and opens that up? It's going to be the county commissioners that meet, and we're going to be meeting and spending some time on Tuesday talking about this. Hopefully we'll have some guidance from Tallahassee prior to Tuesday's meeting. But if you have specific questions for the county commissioners regarding this COVID-19 question, then you can send your email to bocccitizenscomments@hernandocounty.us, and we'll be able to address these questions. It won't be a Facebook Live format, but you can still send those questions, and the county commission will be the ones that discuss the pros and cons and then move us forward up to the limitations set by the governor.
And again, back on testing, I know some people are, and we want to be very clear, when we say we have 83 positive tests, we're not saying that we're 100% sure that only 83 people have contracted the coronavirus here. It just means that of those people that were most likely to be sick, the people who were coughing, the people who had trouble breathing, the people who had fever, the people who traveled from out of state, those people were the ones that were tested, or the people that were in the hospital that were gravely ill. 83 out of the 1,200 and some people that were tested came back positive. That is just used to extrapolate that if you run across somebody that is sick, that's coughing, has a fever, and so forth, they probably have about a 6 or 7% chance in Hernando County, maybe even less now because we're not seeing any new cases of actually having the coronavirus. That's what that number is used for. It is not meant to tell you that we are 100% sure that 83 people and no more have caught the coronavirus in Hernando County. I hope that explains it. Again, as we get more tests, and maybe those tests will be able to tell who did have it and who didn't have it, we'll be able to get some more information. So we have about 4 minutes. Is there anything else you want to talk about?
I'd like to quickly, I mean, it looks like we have a lot of people that possibly join, late in due time. If I could do a quick recap of some of the things you put out real quickly, because there are some decisions that I think it's important to get out of the community. I mean, we see a lot of the same questions coming up, really regarding what business can be open, not barbershops are on there. And so a lot of these decisions are going to come out with the governor's guidance. And that guidance we expect, you'll probably they're working today, they're going to be working on the weekend. Early next week, we'll probably definitely have from the governor what the guidance is on how to reopen the Florida and what the bandwidth that we can operate with Hernando County is. And so that's when those decisions will be. I will tell you again that businesses should be making plans of how they're going to operate and the new regulations that we have. So I think the business is going to have to do some work themselves on how they're going to have a safe environment. So I think all these things opening, businesses and restaurants and gyms are in there, also the YMCA, that's all within the governor guidance that's going to come out next week. We've seen what the president has said, and the governor is going to come out next week. Locally, if you missed it, so what's going to happen locally? The only thing that's going to change immediately is next week you're going to see some. The Board of County Commissioners on Tuesday is going to have a lot of this same conversation on Tuesday at the Board of County Commissioners. Your elected leaders in this area are going to discuss it. A recommendation from me is going to be the parks reopening, and then with some restrictions on those. Pine Island opening with some restrictions again at that point. So wanted to recap on that and. Let's see. So there is, we've talked about this a little bit before. There's some important things that we've all at this point. There is a need in our community. Also, we talked about the need for restrictions and continuing to minimize the spread of this infection in the community. The reason why there's a reopening is some economic importance to get the economic engine going, and people can have part of their lives back. That as long as we can do it safely, there are all those also that need in the community. And so I'll tell you again, if you have excess in this community, the United Way Disaster Relief Fund is a great way. Your local church, your food bank is a great way for you to help out your neighbor without necessarily walking across the street and touching them. And is a great way to look out for others in the community. So those are two of the great ways to look at. And then if you don't know, you can also call the county public information center line at 540-6233, and we can get you hooked up with any local needs. If you have a need that's necessarily out there to help you get through the day, call that and we'll find the resources. There's a 211 line you can call and we'll find a resource for you.
Sheriff, just thank you for doing this, putting this on, inviting myself and the county administrator. I think the collaboration across the government within Hernando County and frankly within Florida and the United States is really paying off during this battle against COVID, so thank you.
Right. And again, if what we were doing was not working, we'd see a lot more positive cases, regardless of how you feel about testing. So the good news is what we're doing is keeping people out of the hospital. It's keeping people from dying. Of course, there are going to have to be some tough decisions to be made going forward, but none of those restrictions or lack of restrictions will prohibit you from continuing to do smart things. Make sure you wash your hands frequently. Make sure that you try to carry some sanitizer with you, some wipes or some sanitizer. There's plenty of places on the internet to find out how to make this yourself if you can't find it in the store. Make sure you cover your cough, preferably in your elbow. That's shown to keep the spray from going better than just about anything. Wear a mask if you're sick. And even better, if you're sick, stay home. Obviously, you don't want to give that to anybody else. If you have an illness, it doesn't hurt to assume you have COVID-19 and stay away from people. Even if you're relatively sure you just have the flu or a cold, stay away from people because people are scared. They certainly don't want to catch it. But again, the good news in all of this is what we're doing in Hernando County, regardless of how you feel about the restrictions or lack of restrictions, it's been working.
It's working.
Please keep it up. If you need your government officials, we're here for you. We understand you're scared. We understand the frustration of not opening up. We're going to do our very best to make the absolute best decisions we can for our community. Again, this is Hernando County Sheriff Al Nienhuis, joined with Commission Chairman John Mitten, County Administrator Jeff Rogers. Thank you, gentlemen, for coming here and trying to take these questions rapid fire. And maybe after the governor's announcement this weekend, maybe we can have another one of these and see how that they will be implemented, those changes here in Hernando County. Thank you for joining in. Thank you for your support of local county government and the Sheriff's Office.